on this, that we would kind of periodically review this? Will this be reviewed weekly with our executive board? I just was curious about that.
So the county attorney can certainly speak to it, but why don't you go ahead and speak to it, Joel? But
the way this is currently written is that it will stay in effect for so long as there is a local state of emergency, unless you all take some sort of action to rescind it prior to that time.
So weekly, when we take a look at this and we take a look at numbers and see trending differently, we could keep the order going and just pull that out, perhaps. I mean, that piece. Well,
keep in mind, this is an ordinance. So you taking action each week on the local state of emergency is really independent of this. So,
but at that time, you could take an action to rescind that ordinance.
You would have to go through the emergency measure to, again, waive notice and do some of the things that you're doing here tonight. But the effective date and duration of the ordinance relies on the local state. But keep in mind, they're two separate actions.
Okay, thank you. There was a couple of folks that mentioned the use of face shields instead of masks in certain places. Does this give us the latitude in certain instances to use face shields versus masks inside?
What I would recommend is, if you all decide that you want to allow that we could modify the definition of, I believe it's face covering, to include shield. I'll defer to you all on whether you want to do that. I don't know if the medical experts have anything to add on that, but we could certainly modify the definition of face covering, which is, what describes the protection being put in place.
Okay, and then we'll get to that in just a minute. Maybe the other one. I just had a few other questions. Just want to make sure I know where we're at with our agreement here. We agreed any person under the age of 2 years old, we put that other language in that would be at the discretion of the parents. Is that something that
would have
need?
To be an amendment?
Okay.
So it was brought up before. St. Petersburg language, it says their language says if a person under the age of 18, that person's use of a face covering is left to the discretion of the person's parent.
Okay.
If that's what you're referring to, you would have to make an amendment to add that.
Okay. So if those kids are out there on their own, parents aren't with them, that's a kind of an open kind of. Yeah, okay. I'm not going to dwell on it. I do think the idea of having the parents' discretion, I'm not sure what the age should be. Maybe it's 13, 14. I don't really know, but I think the parents' discretion is important in that regard. So that's my thinking about it. I was just trying to make sure I understood 2C, where it says persons strictly adhering to and maintaining social distancing. So if people adhere and maintain social distancing inside, are we saying that masks are not required?
And the way it's currently written, that is correct. If they were in an area, and we're trying to think of, situations where it's not a grocery store and there's, you're over here and there's nobody else in this area, if a mask would be required. So that's the way it was written, to provide some latitude depending upon the situation.
Okay, but then you get into that whole measuring thing again. So,
So.
Yeah, I'm just trying to make sure I get the subtle difference here. So,
right.
And then the other one was persons exercising while maintaining social distancing. I'm assuming that's mostly for the gyms or workout facilities, inside workouts, really, because we're not talking about anything outside.
We're not talking about outside.
That's correct. It's only, this is only on indoors, but and I'm not seeing where you're at, but
that's 2F. Page four.
Yes, right, exactly. So primarily at like a gym or something like that.
And then the last question I had was, what did we find? You said you were going to look at something on preschools and churches. Is there any direction for them? Are they still their social distancing? We're not looking at numbers. We're still looking at capacities there, and then social distancing for churches.
Churches would be included in the definition of indoor public place that is in this ordinance. So they would be covered by the ordinance and the mask requirement.
So so in an inside church, you have to have the mask on.
And the
If
same thing,
If you go with the universal ordinance provided, yes,
and the same thing for the childcare facility, correct, Joel?
correct.
Okay. So I just wanted to make sure I got that. I don't know how everybody feels about it, but you know, I think that, you know, the doctors, our doctors that have been talking to us, we've been hearing them at our weekly meetings. We've been hearing them today and tonight quite a bit. I listened, as I said, into the doctors that weighed in over in Hillsborough County, and obviously with the exponential growth, and I know that we got to start thinking now so that we're ready to deal with what's going to happen in 2 to 3 weeks. I'm not sure. I think I've got a pretty good feel that Dr. Cho said that that a lot of this uptick could be from phase 2. I mean, not knowing exactly when that date was, but we're talking 3 to 4 weeks. And so as we continue to do that, and we continue to have situations that have come up, maybe it was the outside, the protesting or whatever, augmented that. We haven't seen the results of that either yet, and nor have we seen the results of that uptick and what spread they might create. So I think there's a lot of concerns, and I think we need to act now. So I'm going to support the universal. I had originally looked at a different one, but I think we need to do this. I really want to monitor it closely. I certainly want to echo some of the comments that have been made that, you know, our doctors are trying to educate and inform people, let people understand the way that they're looking at it. They've gotten no direction from anybody that's trying to uptick this or make it worse than it is. They are telling it like they see it, and we're relying on them. These are true professionals who not only care about their profession but care about this county and care about each one of you, especially those of you who called in tonight. I mean, all of you who called in tonight, really want to say thank you for that. It's really been an emotional time, and you could feel it. And I counted the numbers. I wrote notes down on every single person that called in, and we had about 60 seemed to be in favor, 40 against, and there was 3 or 4 that I couldn't quite tell what they were supporting. But there's a lot of emotion on this, and a lot of people that feel strongly about it. And at the end of the day, I think we do need to ultimately just think about outside of our box and think about other people. So I think there's a whole lot. I don't want to spend a whole lot of time on it. I did want some clarifications on the questions that I asked, but I'm going to support the universal policy. I'd like to see face shields be considered as an option, because I do think there are times when that does work, and I'd like to hear from the doctors on that. I mean, I can be flexible on that one. Certainly, the parent's discretion is important, and I do think that we talked about the sunset date. So I'm just want to hear the doctors on the face shields as a alternative for folks.
I'll take that one, Commissioner Eggers. In terms of, it's my understanding, and Dr. Jameson can clarify this, but or give his thoughts, but it's my understanding that the face shields aren't really interchangeable with the mask. A lot of times they're in combinations, and I think one of the advantages of having both, not that I'm advocating for both, is that it does provide the eye protection as well. But it's my understanding, unless Dr. Jameson feels otherwise, that they aren't as effective, and it's usually in conjunction with a mask.
Okay. Dr. Jameson? Is Dr. Jameson still with us?
Still here. He's still on the line. He was driving the last time that we saw him, so he may just be unavailable at this moment.
Are you able to hear me or no?
There you go. Hey, Dr. Jameson. Yes, we can.
Right.
Hey, sorry about that. The face mask and the the face shield work in slightly different ways. So face masks made out of cloth or fabric have 2 different ways that they can stop particles from moving. One is physical filtration, if it bumps into the fabric, and the other one is through electrostatic charge of the particle hitting the fabric. And the face shield just prevents the direct flinging of a particle out of the mouth. So they're not quite the same in how they work. The point of the face shield is more to protect your eyes, because those are exposed even when you're wearing a mask. And the point of the mask is more to filter the particles coming out of you to whatever extent
How long should I
that particular mask can.
So, yeah, so so you wouldn't want to substitute one for the other, but you could encourage people to use masks or shields if they wanted to, in addition to. That's not,
Yeah,
but you're not.
I wear both.
Okay, okay. And then on the anyway, I don't want to dominate the time. I just need, there's some other questions that we just need to answer as we amend this agreement. And I just want to see if people are on the same page. So thank you.
Thank you. Commissioner Seal?
Thank you. Before I make my comments, Commissioner Eggers did point those out. I would prefer not to have 2C, the person strictly adhering to and maintaining social distancing. And I mentioned this earlier. The reason is you've got to make this ordinance easy to follow. And we have medical exemptions and ADA exemptions and other things, but it's like, how do you measure that? And then the other is 2I, which is patrons or customers in any indoor public place would be protected by a solid barrier such as a plexiglass shield. Again, how do you measure the 6 feet around there? It just seems impractical. I mean, if we got to go there, fine, but I think it just becomes very difficult to enforce. That, and I would also agree to do some kind of parental discretion. And then Jewel already covered earlier that this does cover a child care facility, so that adults would be required to wear masks there. So that's very good. So my comment basically is, I try to live my life in the golden rule. And that really has been important to me and to my family, to do unto others as you would have them do unto you. It's similar to love your neighbor as yourself. And as one of our guests who spoke today said, we needed to be united together to protect one another. And I think that is the most critical piece out of all of this. It may be that I am not being protected myself, but I'm protecting my neighbor. I'm protecting someone I'm encountering in a grocery store. Folks today talked about the numbers. The numbers prove that this is increasing and that we have to address it in a different way. I don't want to be back next week with doubling of the cases, with trying to figure out how the hospitals are going to handle sick patients. I'm grateful that we haven't had that many deaths, but it doesn't mean that we couldn't start to have more deaths as the number of cases increase. I also want to point out that we received a letter from the 3 major hospital systems here in Pinellas County, Baycare, HCA, and Abbott Health. They cited a study that was done by the Lancet. They looked at 172 studies, 16 countries, and on 6 continents, and their conclusion is that masks are worthy of wearing. And I think somebody kept talking earlier about science and scientific evidence. Well, this is based on COVID-19. And so they have been studying this for the last 3 and so months. And I think that speaks highly of itself. The medical community is also very, very concerned about this. As Commissioner Eggers referenced, this is an emotionally charged issue. As many people said, this is not a partisan issue. This is all about public health and public safety. And so I am definitely going to support it. And I respect each and every one of my fellow commissioners, our staff, and I especially respect the time that the public took to try to come in over 5 hours period of time to give their testimony. So I'm grateful for everyone's thoughtful comments.
Thank you. Commissioner Welch?
Thank you, Madam Chair. And I'll just echo my colleagues' comments. A couple of issues, and I think we were all looking at the same parts of this. I had some questions about 3.2C as well, that Commissioner Seal just spoke to, persons strictly adhering and maintaining social distancing. And I thought that might be, and I was thinking through an example, and maybe Barry can correct me if I'm wrong. I walk up to a Home Depot and I say, well, I don't have to wear a mask because I'm going to socially distance when I go in. I saw it as a loophole. And I did see in the St. Pete order, and I don't know if, Brian, you have that.
Yes, sir.
They qualified that with a number of people. If it's 10 or less, then you could default to that social distancing exception. And I thought that put some boundaries around it so it just wouldn't be ad hoc. So I would ask us to consider that or else take it out completely, I think, as Commissioner Seal said. The other thing that's in the St. Pete order that I didn't get a chance to send Brian is under exceptions, and it speaks to religious rituals. In other words, we know that singing is probably a great way to transmit the disease because you're, sending a lot of air out. And so if churches are included in our ordinance, St. Pete has an exception that says these requirements do not apply during a period in which compliance would interfere with the participation in a religious ritual. And I'm thinking that still will allow folks to take communion or sing and still be in compliance with the ordinance. Oh, he does have it. Okay.
Yes, sir.
You're fast. So that item F, if we could consider that just to make sure that churches that are covered now, they haven't been covered before by our orders, would still be able to practice those rituals temporarily and still be in compliance. And I would ask Jewel to tell me if my take on that is correct. Overall, I couldn't be more proud of our staff and partners and our physicians. This is absolutely not a power play or a partisan issue. I can guarantee the folks who are listening that none of us had this on our 2020 calendar, that one of our goals was to have a mandatory face mask ordinance.
Right.
While we were speaking today, both Leon County and Pasco County, which are totally different in terms of their politics, passed a mandatory face mask orders. It's no more partisan than when a hurricane is coming at us. We don't make partisan decisions. We make a decision based on the data, the trends, what the experts are telling us about public health and public safety. And this is the same way. I couldn't say it any better than our doctors have already said it. We are at a crisis point, and I don't believe we've seen the impact of phase 2, which was June 5th, which is barely 2.5 weeks ago. And the George Floyd protest started that same week. And a lot of those folks were wearing masks, if you go back and look at some of the photos. So I think, as Dr. Jameson has said, if you talk about a 3 to 4 week window, we haven't even seen that yet. Our folks are telling us what's happening in the ERs, telling us what happened in the hospitals. And we are compelled to act on this. And so I'm certainly going to support the universal ordinance. I think it's very well crafted. I think it has exceptions for folks that have health issues or claustrophobic or any of those issues. Our team has done a great job of putting together a responsive ordinance. I do think one thing we've heard is we have to educate folks so they don't have that false sense of security that, okay, I'm wearing a mask, now I can ignore everything else. We've got to continue to push that education and continue that enhanced enforcement on businesses that see what's happening in their businesses is out of compliance. We've got to, kind of tamp down on that. And the last thing is the availability of the mask. You just talk about that. In Pasco's press release, they talk about different places in their county where they'll make masks available. And I'd ask Barry to talk about what our plans are to distribute masks or acquire masks as we go on. But I support it if we can just look at those 3 options as we further the discussion, Madam Chair.
Okay, great. Commissioner Peters.
Madam Chair, I would have loved to have heard what Barry had to say before I do my comments. Well, he asked a question. I'd like to hear the answer.
Okay, fine.
Thank you.
Okay, so on masks, there's been a number of efforts regarding masks. Masks are not publicly distributed in all locations. However, we've had a few locations where we've got in masks. We've pushed them out to community partners. I know St. Petersburg has pushed out masks. We pushed out some this last weekend through community partners, through chambers, and through a variety of other means. As we get distribution in, well, we can enhance that somewhat. But I don't think the mask issue has been a problem. However, it's not. We haven't had like a public site that anybody can go to that we've set up for a long period of time.
Yeah, I'd like to see us do that too, if we can. Well, we can talk about that, but I'd like to see them more available. Those people who don't know where to get them, can't afford to buy them, whatever.
And I think I've said we have ordered and are actually purchasing a significant supply. So we, based upon the discussion last Thursday, we enhanced our effort on that.
Okay. Commissioner Peters?
Okay, so I have a couple questions before I make my comments. So Dr. Cho, I want you to clarify on the shields. And I want you to clarify for the people who have very clearly said they're afraid to wear these masks if they're wet, if they, you know, if they're wet and it's going to cause things, right? That they quoted OSHA, which is the federal and the state law in the state of Florida. So they've quoted OSHA on the carbon monoxide and they've quoted OSHA on the dampness of masks. So you said you didn't think the shields were appropriate to keep in this ordinance, and I'm curious why. Given you have people that have claustrophobia, given that people believe that the carbon monoxide is an issue and people believe that the moisture is a problem, why do you think that it's not an appropriate solution?
All I mentioned, Commissioner Peters, was that it's not interchangeable in terms of the effectiveness. And I think Dr. Jameson talked about the mechanisms, a difference between between having the masks and the face shields, the effectiveness of it using the mechanisms of having that barrier versus the face shield, which is essentially like a plexiglass. You're just getting the large particles, but it doesn't, again, in terms, I don't believe it to be interchangeable is all I'm saying.
So I guess my curious is, I mean, would you support if it was a shield? Because this was all about aerosol spray. Everything was about droplets and aerosol spray. It wasn't, because it doesn't transfer on surfaces. There's a lot of whole new information coming out. Now they're saying it's all about blood type. That report just came out like 10 minutes ago. So would you support a shield in lieu of a mask is what I want to know.
Again, all I'll say is a mask is probably more effective than a face shield. So in terms of what your level of comfort in terms of with that fact, and again, as Dr. Jameson mentioned, in terms of the mechanism, it just isn't as effective as a face shield. I mean, sorry, as a mask.
Okay, but well, that didn't answer my question. I understand where you stand on the differences, but would you support that in an ordinance? And if you don't want to answer it, that's fine, I understand. But I just want to hear yes, no, or I don't want to comment.
Well, I think my position is really just to inform and educate. And again, okay. I think I was there more to tell you the difference. It is not as effective as a face mask. Okay, all right. So,
so I guess my other question is, when we closed, we knew when we reopened that we knew that there would be an impact and numbers would spike. Was there any parameters set to determine when the spike was an issue, just out of curiosity? Because we expected this, we absolutely expected this. We had time to prepare to get PPE. We had time to prepare to get people out of the ICU. We had time to prepare to get hospital beds open, and hospital beds certainly were open since we weren't doing elective surgery or anything else. And people were afraid to go to the hospital. So we knew the number would spike. Were there any parameters about what the number would be, what the length of duration time should be, that the spike should be? I'm curious about all that because we didn't talk about that at all.
Well, I think one of the things we talked about was the percentage of tests that come back positive. And we said all along that if they came back more than 5% positive, that was a serious problem. and we're at.
I was directing the question to Dr. Cho, though.
I
Madam Chair, and
appreciate
all
that.
due
He
respect.
wasn't answering, and I remember us talking about that very clearly.
From a guidance standpoint, yeah, there is a number of guidance out there with reopening documents. As Commissioner Gerard mentioned, I think some of the reopening documents, as mentioned, the 5 to 6%. I think overall, it's really a decision really at the EPG, and it requires that discussion with EPG as well as the BCC. In terms of the numbers, obviously we look at those metrics such as the case count, such as the percent positivities. We look at, and the big concern and the reason we did the flattening the curve to begin with was the hospital capacity. So I think it's looking at multiple factors and really coming up with what our level is locally.
Okay, and thank you. I think this is important to talk about because you have a lot of people making assumptions, and I think it's important to talk about all of that. So I do have comments about some of the callers and all of those that said we're not, other people aren't listening to scientists. And I just want to say that I believe that the people that wrote the OSHA guidelines and the people that wrote the CDC guidelines and the people that wrote the World Health Organization have lots of scientists that are giving the guidelines. So I do just want to make that comment. I also want to make comments about some of the nurses that said they wear surgical masks all day long and they don't have trouble breathing or wetness. That's not the same as a cloth mask. And a lot of the medical personnel talked about how they wear a mask all day, but they don't wear a cloth mask. And my issue is really the cloth mask. Clearly, you all know my issue. I've not been hiding the secret about my issue and the health and safety about wearing a wet mask for a long 8-hour period for somebody who's working outside, who's sweating and breathing all of that back in there and the moisture. So I just want to kind of go out and make comments about some of the callers. The wonderful young gentleman that called, young adolescent who called, who made the comment that the warning sign doesn't say that it'll take care of 100% of the COVID places. What it actually says, and I need this to be clear because we didn't read it all out loud, is this product is an ear loop mask and this product is not respiration and will not provide any, doesn't say up to, it doesn't say, it will not provide any protection against COVID-19, the coronavirus or other viruses or contaminants. So I just want to clarify for the record, the young gentleman that called in or the young adolescent that called in, I never said that the warning was it couldn't prevent up to 100%. The warning says it cannot protect at all on any level, can it protect against the coronavirus. And there's a big difference between up to 100% and at any level. And I just want to make that really clear. And again, I just many times I was listening to the nurses and the doctors who do not wear a cloth mask. And on the OSHA guidelines, again, scientists wrote these guidelines, says that carbon dioxide does increase within a cloth mask. So I guess my point is I really would support an amendment that says a shield would work in lieu of the fear and the moisture effect that can impede somebody's health from wearing a wet mask. And I know, Commissioner Welch said he wore a mask for 6 hours the other day and he didn't change it. And Dr. Jameson said the same thing. And just because you didn't change it doesn't mean you shouldn't have changed it. And there's a difference between what you maybe should have done and what you did do. And when it comes to moisture in the mask, the OSHA guidelines are very, very, very clear. So I just feel that we're discriminately picking winners and losers. We can have people go to a gym and not wear a mask, and we can have people stand in a choir in a church and not wear a mask and sing and shout and sweat and breathe heavily. And yet if I go into an alteration shop that 3 people might go into in a day, I have to wear a mask. So I have some issues with a lot of this thing, but I really do believe that we should leave the discretion to a parent. I have 2 grandchildren that are special needs, and those 2 grandchildren that are special needs will never wear a mask. And I think it is up to, or they wouldn't wear it for very long. So I think it absolutely should be up to the parents to wear a mask. And I also believe that we should allow for shields to be inclusive in a face mask. And I don't see that there any reason why. I also want to make a comment about H1N1. When that came in, there were signs in every single bathroom and every single business in this county. And I have yet to go into a bathroom where I have seen the same efforts on the hand washing signs and the hygiene signs that I saw on H1N1, and we have not seen that. I also would like to address the concealed weapons permit. Although I called Marion Hammer, who I believe is the utmost expert on when it comes to concealed weapons. I think that the last caller was right, and that we really should have Jewel or her team look into that in writing and where it says that. There clearly is fear. I had many people texting me today, and as long as there's fear, I would like to see our legal staff at least get in writing where she is correct. And if you need to call her, I have her phone number. That's no problem. I think that's pretty much all I have to say on that. I will not support this, but I would absolutely, if you're going to go through, I would love to see a motion, and I'm happy to make the motion if somebody would second it, that the parents have the discretion and that a shield would be a substitute instead of a mask for those that have anxiety, those that fear the wet, damp mask. I think it's a great alternative solution. It would stop the spray and the perspiration that comes out of the mouth. So I would make that motion for those two things. And if either one of you would support that, I think that would be a welcome second.
If I can interject, we do need to take the motion to waive the notice requirements and find that an emergency
Wait.
exists for the immediate passage before we take any action in regard to the actual ordinance.
Okay, thank you. Yes, Commissioner Welch. Oh,
Are you ready for the
All right.
motion to waive the?
Commissioner Long, did you want to comment on that first?
Yes, I did, Madam Chair. I just wanted to, number one, acknowledge, excuse me, that we do have the business community folks who have chipped in considerable dollars to provide masks to our community. And I think that that deserves a huge acknowledgement and big thank you from all of us. And secondly, to Barry, I would like to know, at what point does this ordinance take effect?
So the expectation is that we would hear back from the state rather quickly. So you could choose tomorrow at 5, you could choose the next day at 5. I mean, I think it's up to you, but a time certain, I would suggest that we go ahead and put a time certain in there for the effectiveness.
Thank you, Madam Chair. And I have one, excuse me, follow-up, if you might allow. What is the mechanism that we will use in order to inform our citizens if in fact this were to pass this evening?
Our plan would just be to, well, first it's going to be out on in the media and stuff. We can do any kind of follow-up. Certainly the information is going to be out. If you want us to do individual letters, it's very hard, obviously. We can certainly do that to businesses, a little more difficult for the general public. So from that standpoint, we can certainly do any direct correspondence with businesses. Distribution list is for that. But other than that, it would just be through word of mouth.
And one last question, Madam Chair, if you might. And how will this affect our many municipalities in this county that are having ongoing council meetings within their communities with their elected officials? Will it apply to them?
Under the way it is written, it does not apply to the municipalities, and that's part of the reason that each municipality is kind of handling their different situations. We discussed that earlier, and whether or not you waive that for the governmental entities or not. The only reason on the governmental entities, you have a lot of different types of camps and things like that. Most have established procedures, if not all, under that. As I said before, if you want to include all municipalities, you can simply take that provision out if you don't want to exempt them.
Commissioner Long, to be clear, this is a countywide ordinance and it would apply within the municipalities. We've just exempted the government facilities and put the obligation on the actual municipality to deal with their own facilities. But within the municipality it would apply. This is a countywide ordinance.
Commissioner Justice?
No, I'm fine. I'll wait till after we do this part.
Okay. I had a couple of issues myself. The total exemption for kids, for children under 18 seems a bit broad to me. I mean, I don't know about you guys, but I was running around by myself with no parents by the time I was 10 or 11. I had kind of a permissive family, but, but by 12 or 14, most kids are on their own. And frankly, I wouldn't trust, we can't even trust the adults to put masks on by suggestion. We're certainly not going to see kids doing it. So that's, I'll get to you in a second. Let me see. To Commissioner Peters' issue about the shields, frankly, I'd much rather see somebody wearing a shield than absolutely nothing. I mean, I don't think it's going to provide a whole lot of protection to the person standing in front of you, but it beats just having nothing on your face, I guess. And I have some issue also with singing in church. I mean, we already know that that's a terribly, it's a great way to transmit the disease to everybody around you. I mean, I don't have any problem with people having their religious rituals, but I think when we know something is going to cause a problem, that we shouldn't exempt it just because it's religious. I don't know if that makes any sense. Commissioner Justice.
Are we, thank you, Madam Chair. Are we going to take up the waiver first
Yes, we are.
before we get into the meat of all the amendments and everything? That was what I was going to ask you.
I just wanted to make sure I got to say something because I never do. Yes, so we almost had a motion from Commissioner Welch.
I will restate that motion to waive notice.
Okay,
Need to say anything else, Jewel?
is that a second?
And to find that an emergency exists that justifies the waiver.
As our counsel has stated, that's the motion.
What she said. Commissioner Seal, was that a second?
Yes.
Okay, thank you. All right, we have a motion to waive the requirement, the notice requirements for this. All in favor, please raise your hand, say aye.
Aye.
Or not. Opposed? Was that a yes or a no, Commissioner Peters?
That's a no.
Okay, so motion carries 6-1. Okay. Next issue. Yes, Commissioner Justice.
Thank you, Madam Chair. Now if we're
Yeah,
back,
yeah.
if we're back on the bill, to use Tallahassee speak, we're back on the bill. I would agree with you. I think, I don't know about the difference on a face shield. I think if they're wearing that, if they need to wear that as opposed to the mask for whatever reason, I think that's a step in the right direction. I'm probably a little bit more lenient than you on the for children. I don't think we want store managers or police stopping kids to do it. I think that just sets up so I'm fine with the way St. Pete did that, the way the sheriff suggested. And I think that the strictly adhering to the distancing that's in 2C, there's opportunities in public offices where it may be that makes a lot of sense, to where if you have a set number of people in an office and there's enough distance that they don't have to be wearing the mask all day. I think that makes actually a lot of sense. And I think at the end of the day, we're trying to get to people to voluntarily go along with this. And appreciate the sheriff's input. And I know a lot of people beat you up today because I think they thought your opinion was different than what it was stated at the beginning of the meeting. So I hope they'll go back and re-examine that. But I got to tell you, when I heard St. Pete, when I heard the mayor of St. Pete was doing the second level of the enforcement last night, I think I kind of felt like a lot of people, like, you know, a little apprehension. all along, this entire process, this county commission has tried to be the least restrictive possible when putting in parameters for safety for the people of Pinellas County. Whether it was our beach openings, our Safer at Home Act, only closing the businesses after the governor rendered them non-essential. Every step of the way, we've tried to do that. None of us have wanted to get to this point of having to require the face masks. You've heard that in the conversations in all our meetings all the way along. The fact that we are at the point where it's going to pass tonight tells you that we're hearing the numbers, we're talking to the experts, from enforcement, from the administration, to medical examiner, to EMS, to ER, to our director of public health, every single one along the way. We're not paying them to go along with us. They've been dragging us along in some ways. So it is the last tool we have in the toolbox, and I will be supporting that move tonight. Thank you, Madam Chair.
Well, me too. And I just wanted to tag on to some things that Commissioner Long was saying before. You know, we've been here for 6 hours talking about this week. And last week, I don't know how many hours. And over the last 3 months, I don't know how many hours we've spent talking about this and trying to figure out what the best thing to do was. For those of you who wrote in or called in and said, I'll never vote for you again, or you'll never get elected again. You know what? If I don't do what I think is the best thing for my community, I don't deserve to be here. And you can threaten me all you want. And I'm sure that goes for the sheriff and for all the rest of us sitting here. We're not here for our own good. Commissioner Welch.
Yeah, Madam Chair. We heard that with fluoride and with term limits and with green light. I don't think folks vote on a single issue. And as many people as we heard tonight, we received hundreds and hundreds of emails, and they probably were 60-40 in support. I stopped counting at about 300. And
we're over 1,100 now.
Yeah, we appreciate everybody that weighed in, but we've got to do what's right based on the science. So I just want to ask if we, going back to the social distancing, the item C, if there is support to on section 3.2C, we talked about persons strictly adhering and maintaining social distancing. If there's support to substitute St. Pete's language, which essentially says the same thing, but it qualifies it with a location that has 10 people or less. And again, I'm sorry?
I was just going to have the specific language in case, because it's not up.
Okay, well, while he's pulling that up, I just want to explain again my thought process that if somebody walks up to a Publix, they could say under this, I'm going to social distance, so I'm not wearing a mask. This language would pull Publix out of that because there are more than 10 people in there. I just see that as a loophole that we could close if we use St. Pete's language. Brian, do you still have it?
Yes, sir. Bring it up
Okay,
here.
so we have several changes that have been proposed, and probably need to go through them one at a time.
Yeah.
Okay, let's start with that one since we just talked about it.
And Commissioner, this is the one that you had sent me earlier, correct?
Right. And you notice I had to scribble on it, Barry, because they did not scan it as text. That's St. Pete did not scan it as text. But that section 5B essentially says what our section C says, but it would limit it to places of business that have 10 or less people in it. I'd be more comfortable with that one if there's support for it.
I could go along with that.
Madam Chair?
Too.
I can't see you all, but
Question?
yes, go ahead, Commissioner Justice.
Is that 10 people in an office, or is that like I'm walking into a office building, but there's only going to be 5 people in my you know what I'm trying to get to is,
right.
and again, I don't think we're going to be like going around with the counter or anything, but
I'm more, yeah. My concern was more on the other side, not having somebody walk up to a Home Depot or a Publix and say, "I'm just."
Keep in mind that the restriction only applies in what a defined term, indoor public place, which is a location to which the public has or may obtain legally permissible access. So, you know, many office buildings, I mean, even my office here in a public building, the public doesn't have a right of access to my office, even here in a public building. So I would say most office settings, this isn't necessarily going to apply to. So keep in mind, this is geared towards places that the public has a right to access.
And that was my concern, a large retail place.
Right.
I wanted to close that loophole.
So Commissioner Gerard, from an enforcement standpoint, I would really, really encourage you all to leave this provision in, even if it's watered down a little bit to where Commissioner Welch suggests. You have a lot of small businesses out there, a lot of small retail shops, tailors, shoe stores, those kinds of places. And, you know, a lot of them are having people where they are spread out. They're at different ends of it. And I'd ask from an enforcement standpoint that you do include it. I know Commissioner Seal has some concerns about it in mass, but this again is a compromise. It's a happy medium. And I would ask for us that you consider doing that.
Are you talking about the way that he's asking the change, or the way it's already written?
No, the way he's asking the change, compromise, you know, and I think that Commissioner Welch is suggesting compromise. It's a happy medium. It gives us a tool that we could use, and it isn't full blown. And some of you have expressed concern about it the way it is now. This brings it down, but it still allows flexibility.
Okay.
So I would move that as an amendment, if that works, Madam Chair.
Yes.
Okay.
I agree with that.
And I'll second it.
Thank you.
Okay. All right.
If I could make a suggestion.
Sure.
So that we don't get into a position where we may need to take public comment on individual votes. If I could suggest that you all reach some consensus on the things that you want to change, I'm making a list of it. I just don't want us to get kind of caught up into the, you know, do we need to take comment or not, as particularly if you all are reaching consensus on these items.
Okay.
So I'll withdraw
Sounds
that.
good to me. Okay.
I'll withdraw.
Do we sort of have consensus on that one, though?
Think so.
Yes. Okay.
Can you restate exactly what it is so I know the language? I think it's good for the people to hear the exact language.
Substituting what we had on the screen before from St. Petersburg for
the language would state these requirements do not apply if less than 10 people are in the location and the people in that location maintain social distancing. For purposes, there it is.
Okay.
Thank you. I appreciate it.
Okay. Next issue, face masks versus shields, or shields, or shields as a secondary. We heard that.
Sorry. Sorry. I apologize.
Okay. How does anybody feel about that one, about having shields as an alternative?
Just
Gregor?
a question. Could it be something like, if for whatever reason a mass use is exempted, then a shield would be an acceptable substitute?
Well, yeah.
We can do
No.
that.
I'm saying no. Okay.
No.
I'm
Okay.
trying.
Yes, Commissioner Seal. Yeah, I hear you.
Commissioner Akers, while I would like to do that, I think Jill would advise us that that would create ADA problems. It could create, you know, the other exemptions. If we say instead of a mask that you, I don't know, Jill.
I think probably the cleanest way for you all to address this, if it's your desire, is we would modify the definition of face covering to just include the shield as an appropriate face covering. And then essentially all the other exemptions that apply would also apply here, including the one that's for ADA purposes.
Okay. That sounds acceptable. Okay. as far as a time certain to have it take effect, we need to have that in there. Yes, Commissioner Seal.
I would like tomorrow at 5 p.m. Tomorrow, June 24th.
Sounds good to me.
Works.
Okay. Okay, what else did we have? Yes,
So
Sure.
the second item, did you call me Madam Chair?
yes, of course I did.
Okay. So the second item I brought up that you referenced was the religious ritual.
Yeah,
And let me just add to the church. My church is all virtual until through July, and a lot of churches are. But the few that I've seen either have very few people spread out in the choir stand, 4 or 5, maybe 10. So they are socially distancing. They're not.
Yeah,
they're not on top of each other.
and
So
after
one
I
thing-
said that, I realized they had to be socially distancing anyway, so,
But
okay.
you know, the sheriff had a suggestion. Maybe we add these requirements do not apply during a period in which compliance would interfere with participation in a religious ritual, and then add something that says, you know, social distancing requirements must be maintained or something like that. So
Yeah.
we're saying, yeah, you can sing or do communion, but you still have to adhere to
Okay.
social distancing. I think that would, again, be a good compromise.
Yeah, I do too.
Okay.
So Jewel, the changes, was there anything else?
There's the age group, the
Oh, the age.
Yeah, did you all address the age? That was going to be my question.
I may be the only one that has concerns about that, but whatever. I guess if the parents are insisting on it when they're around, maybe the kids will comply when the parents aren't around, like kids always do. Welch.
And we're doing so well, Madam Chair, but you know, just so a 15-year-old goes to Walmart and they say, my parents say I don't have to wear it, so they can go in.
Yeah, well,
The way that would be written. So
You could, just as
that's
a
what I have a
suggestion,
problem with.
you could do it as a suggestion when they're when they're with their parents or something to that effect.
Right. Commissioners, what I had looked at was the language from the St. Pete ordinance. It says a person's under the age of 18, except that person's use of a face covering is left to the discretion of that person's parent, guardian, or accompanying adult when the minor is in the presence and accompanied by their parent, guardian, or accompanying adult.
Right.
You know,
So what does that mean when they're not in the company of their parent or guardian?
Well, then they would have to wear a mask, but the problem, and presumably a child who's small enough not to wear a mask wouldn't be out by themselves.
Right. And honestly, I think 2 years old is too young
right.
to be requiring. I mean, I would say 5 or 6 at the very youngest. That was the other issue I had with age. Mr. Peters, you had something? I think.
Thank you, Madam Chair. So I think as long as they're I think the St. Pete language is good because as long as it's in the presence of the parent, so the parent has the discretion. So if the child has severe anxiety, if the child has autism, we don't have to ask if they have autism. If they're in the parent's presence, I think that's the right way to go. So I think St. Pete language is really good. And to your comment about, you know, they're not with a parent, well, anybody, whether you're 15 years old or 30-year-olds or 60-year-olds, you can say, I have trouble breathing. And you are not required to wear a mask. So, I just think, you know, if you're worried about all that, I think anybody can say, I have trouble breathing. We don't have to prove it with a doctor's note. So I think you just leave it with the parents, but I just want to make that comment, you know, just because they're not with a parent, they could also say they can't breathe really well and they have trouble breathing or they have asthma and they don't have to prove it. And so same kind of thing.
Okay. So it doesn't matter how old they are, if it's all at the discretion of the parents.
That would be my recommendation. Yes, I would
Okay,
agree.
I mean, if that's what we're doing, then we can take out A there. Right?
Well, I was going to substitute while I'm drafting this to kind of meet what you're saying. I was going to substitute any person under age of 2 years old would be replaced with a person is under the age of 18, except that person's use of a face covering is left to the discretion of that person's parent, guardian, or accompanying adult. And now this is the part I'm not clear on. What I think I'm hearing is this exception is only applicable if the minor person is in the presence of the parent, guardian, or accompanying adult. Is that part correct or not?
Well, no, because then you're saying that they have to have it when their parent's not around, I think.
Well, unless a different exception applies, like Commissioner Peters was saying, if they have a medical issue or something like that, it doesn't matter how old they are.
What does she care? She's not gonna vote for it anyway.
Commissioner Long, you're
Thank you, Janet.
on a live mic. Okay, but I'm still a little confused about that because.
That was just what I thought I heard. I can take that out.
Yeah, I think it's easier to just take it out.
Yes, ma'am.
If we're not gonna, okay. So Jewel, given what we've said and come to consensus on, we haven't changed it too much to actually vote on it, have we? Okay, good. Alrighty then, Commissioner Eggers.
Yeah, just again, I understand the excitement. Excitement's the wrong word. Trying to get this thing implemented quickly. I'm just thinking about the businesses that wake up tomorrow and they're being told by the end of the day today. I know I brought up, Sheriff didn't come out and excitedly say he wanted to put signs up again. So I'm thinking that's probably not on the top of his list, but we got to give these businesses time to put together their own, whatever they're going to do. And I think maybe tomorrow's a little quick. That's all I'm saying. I'm thinking maybe Thursday at 5 or something. Just give a little bit more time to the businesses. I'm not trying to nitpick this thing, but I think tomorrow is just, too quick. I mean, get the paper tomorrow morning and read about it, or they read it online tonight, or it doesn't give them any time. So I would just give them an extra day at least. So no big deal.
I would say we're days behind, if not a week behind everybody else doing this, and they didn't get any notice there either. So,
Well, okay. So you know what the notice they got there? Was it less than a day? I don't know.
Really, you know what? I don't really care that it's less than a day. I think it's time.
Well, I do. So I'm just one person.
I'm just disagreeing with you.
Okay, that's fine.
I think Pasco was immediate.
Yeah.
Okay.
And Leon.
Pasco was immediate. They did an executive order from the administrator,
right?
And it was immediate effect.
Most of them haven't even had all this discussion about it. They've just put orders in place. Okay. Do we have a consensus on the timeline then? Tomorrow at 5, did we say? Okay. All right. Okay. Yes, Commissioner Welch.
Thank you, Madam Chair. What did we decide on the age?
We're just taking it out or we're putting in that parents will make that decision for their children.
Okay, so the St. Pete language, basically.
Yes, it's the St. Pete language.
Okay.
Okay. All right. Is that it?
I think so.
I will entertain a motion then.
I would be happy to make the motion, but I would like to have Jewel review the changes so that we are all clear.
Yeah, here's what I have. So we're changing what would be an exemption for anyone under the age of 2 to the St. Pete language that we just discussed, that would put it at the parental discretion for basically for minors. And it's the language that Brian had put up. We are modifying our social distancing exception, which is currently under section 3, 2C, so that it will apply, that it will only apply when there are groups of 10 or less, so that we cover Home Depots and the like. We are inserting an exemption, the St. Pete language, for religious rituals, so long as they can still maintain social distancing. We are going to modify the definition of face covering to include the use of face shields. And we will make the effective date and time June 24th at 5 p.m.
Okay. Is there a second?
I move.
Yeah, I have a motion from Commissioner Seal. Do I have a second?
Second.
Thank you. Commissioner Eggers.
Yeah, just want to make sure I'm clear. So churches will they'll make their own decision about whether people will be singing. We're not
It
going
need to be social distancing.
Yeah, but they have to socially distance, but whether they choose to allow singing or not will be up to the church itself.
Yeah, we didn't say anything about singing.
I understand. I just want to make sure
Religious rituals, right?
Yeah. If you consider that a religious ritual, I just wanted to.
Covers a lot of territory, actually.
Sure.
Okay, all right. Thank you.
Anything else? Okay, we have a motion from Commissioner Seal, second from Commissioner Welch. All in favor say aye or raise your hand, whatever.
Aye.
Aye.
Aye. Opposed? Do we have any opposed? No? Okay. Motion carries unanimously. We still have a lot of business to take care of.
We still have an agenda.
Yes, we do.
Wait, Madam Chair, I'm sorry. I thought we were voting on the amendment, and that's my fault. So I really would like to change for the record that if we were voting on the whole bill, that's
We were
no.
voting on the whole thing.
And
Okay.
I apologize for that. So please strict that and change the record for a
Sure.
no. And
Okay.
I do want to make one statement. I'm sorry, I was reading something, I didn't realize it. I did want it on the record that I do support masks. This isn't about that. I do support masks. What I do not support is mandating masks, and I just wanted that to be clear.
Okay, thank you. Item 22, Habitat for Humanity.
Item 22 is a contract for sale for the purchase with Habitat for Humanity for the sale of 27 vacant parcels located in the Danville neighborhood.
Move approval.
Second.
I'm sorry, who was that first? Welch? Yes, okay.
Justice.
Welch,
Justice.
yes. Okay. Okay, we have we have a motion from Commissioner Welch, second from Commissioner Justice. Commissioner Long, did you have something you wanted to say?
I did, Madam Chair. I just wanted to know, could someone please